Hi, good morning. Good morning, lovely people. Okay, so let me share my screen. Since we're just searching for jobs and we're not doing anything extra, I'm going to share my screen. Okay, so let's get on LinkedIn. And some of you are wanting, by the way, the biggest question I'm getting from the mentorship is, can I enroll and then use it later? Absolutely. The mentorship is can be activated anytime. I honor it. And some of you are asking that because you're being warned that as of June, you may or may not have a job. So in fact, one of my mentees literally just texted me this morning from one of the public health institutes and said that she's been informed she's in that category. And so she's currently with me in the mentorship, but she's already told me like June isn't looking good for her. So just as a heads up, that is the most common question. Some of you just want to know, um, uh, can I use it later, like in the summer? Yes, because I don't anticipate opening up enrollment until again, like August or September. So keep that in mind as you're making your decisions. Okay. So what I wanted to do was point you guys towards some foundations and, ugh, what is happening? So I wanted to point you guys to some foundations that you might not have heard of yet. Um, and yes, you can simply search the word foundation as a way to look for jobs. Foundation, association, philanthropy, um, what other way do they describe themselves? Grant making, sure, you can search the word grant making. But the reason I like the foundations is because a lot of them are actually, this is how a lot of foundations are funded that are in the space of public health. They're from generally two main fund, like the way that they're organized, if I can describe it, is that there's foundations that basically are from the for-profit corporate arm. So an easy example to me is the Hilton Foundation. That's why I was trying to pull them up. Conrad Hilton Foundation. They're here in Los Angeles. But the reason I like them as an example is because a lot of us wouldn't really naturally run into them. Um, a lot of you wouldn't naturally run into them, and it could be just due to the nature of your searching, just due to the nature of how you are, oops, sorry, there we go, how you are putting together your understanding of your work. But there are foundations out there that are solely funded by the corporate arm. And as you can imagine, the Conrad and Hilton Foundation is funded by the Hilton Foundation. I mean, the Hilton hotels. Sorry. So yes, there is a way that Hilton hotels, or at least that family, has found a way to build their presence, build their, social impact, and kind of put their name out there in a positive light outside of a for-profit corporate space. And as you can see on my screen, these are the general spaces that they're in. And this foundation came up recently because I had a mentor session with one of you. You enrolled into the masterclass and I got to meet with you recently. And she mentioned that she used to work for foster youth and she just felt like she couldn't find any more work for foster youth. And I was like, oh my gosh, are you kidding me? That's actually an area that's growing and constantly being funded for. TAY, transitional age youth, are constantly being considered in different ways. It's not easy to find those options, but if you're mindful of foundations that have a focus, such as the Hilton Foundation, she had no idea that they did this. You'll notice that foster youth is one of their initiatives. Homelessness is another one, early childhood development. But then notice that they talk about their international work Sorry. You'll notice that they talk about their international work through refugees and safe water. So this is another good example of how the foundations focus on global health. Okay. So for those of you who keep coming to me like, I want to work in global health, global health, global health. Okay, we'll have you search safe water, sanitation, right? How do global health philanthropy, large NGOs frame their work? And here you have an organization that calls it Safe Water. It's their Safe Water initiative. Okay, so if you want to work in, and then obviously there's the space of refugees, and some of you are worried of like, oh my gosh, there's no work for, immigration and refugees, but honestly, there's still a lot of work. There's a lot of work. It's coming from these organizations, from these foundations, these philanthropy groups. Okay, so I was going to try to prepare a nice like Word document to share. I might be able to share it by the end of the day. It's kind of still in draft form, but I found like a good 30 to 40 organizations you guys can start poking around. Ford Foundation, right? Ford Foundation funded by Ford. So I'm trying to point you guys to some of those obvious groups. That's the for-profit arm, the corporate arm. Where's the second type of group? Is that healthcare arm. Okay, it's that healthcare nonprofit community benefit community health arm. I don't call them as for-profit because they don't like to consider themselves for-profit healthcare companies, but we all know that they're in it for the money. But what I differentiate them from Ford Foundation or Hilton Foundation because it's clear that they're run right through products. They make money through non-health related services. Then you have healthcare health plans like Blue Shield and Kaiser and Centene, right? Aetna, so many who also make money, healthcare companies, but due to the nature of how their revenue stream runs, they actually call it community benefit or community health, and their initiatives also range widely. They have a huge portfolio of work. It could be anywhere from homelessness, education, employment, mental health, maternal health, children's health, right? That's the work that I did at Kaiser, was I got to work for the community benefit department for the Southern California region across 13 medical centers and hospitals. Loved the work, but I got to talk about all the topics, foster youth and even wildfire issues that we were having, right? We were considering funding certain initiatives like the American Red Cross. That's the kind of stuff that you get to do when you work at these kinds of organizations. So pointing you to where the money is. Questions. Questions on any of these philanthropy groups? Do you have advice on how to stay? Oh, no new question. Okay. Let's look up safe water just to see if something comes up different. Oh, cool. World Central Kitchen. Oh my God, I love them. Do you guys know about World Central Kitchen? This is a 2-year term. Love this. Hello. Wake up. Wake up. Community Outreach Manager for the World Central Kitchen. They will consider your application if you're from Georgia, Colorado, Texas, Florida, or Louisiana. It's a 2-year term. Some of you are worried about like contract terms, but this is a good one. If it's like 2-year, 3-year, I know the 1 or 2 contracts that I've been in were always like a 3-year and likely to renew. And this one is probably in that same space because the World Central Kitchen, for those of you who don't know, they actually provide food to other countries in crisis, in emergency management, disaster preparedness situations, right? Hurricane relief and all of that, tsunami relief. So World Central Kitchen is highly funded, always in the news, very well really well known across the global impact community. So this is a good one if you guys want to take a look at it. It was posted 4 weeks ago. I will change my search. Sad that I only see 6 applicants. Obviously, this is a lot of travel. Probably why people are not applying, but some of you want to travel. Some of you are in the space of wanting to travel. Requirements. Here we go. This is it. That's all they want. They want 5 years, 5 years of experience in management, preferably in fast-paced, ever-changing environments, including military, emergency response, culinary, humanitarian, or event management settings. So some of you are out there implementing like COVID pop-up clinics, right? Like the vaccination pop-ups. I know some of you are, that's on your resume. That's an example of emergency response you participated in. Ideally, yes, if you were a supervisor at any point in your career, they would love to hear from you too. Okay, I'm going to put this in the chat. Oh, cool. Valley Children's. Oops, I need to change this. Do I have any requests in the world? Like, I know I'm going to be focusing on remote. I said remote and for profit, but you guys are welcome to let me know what you've been interested in, like global health, maternal health, children's health, mental health, whatever it is. And then I can kind of keep that in mind as I'm sifting, right? Right now, I'm just kind of starting from a blank slate of like, hey, this is what I would do if I were you.
A question
Yes.
from you. Bo.
Hi, you
Um,
go.
yeah, thank you so much. I have a friend who is also in the job market, and she is focusing on her own local area, which is Maryland, because she felt like remote jobs are just so competitive because it just increases the application pool. And I'm wondering like what your thoughts are on that.
It's the same. It's competitive, I think, whether you look locally or not. Um, I think looking locally is great because it also helps you feel connected to community. I know remote work can start to get really like, you know what I mean? You're just alone a lot and it starts to kind of feel like you're not getting coached or mentored or guided. I know that was the biggest complaint or concern from the workforce that was through the COVID period. And they felt like they were in the quote unquote in the dark by themselves for like a couple years, especially through school. And they really wanted like in-person feedback and a manager on site. And they just were like, I need coaching, I need mentoring and guidance and role modeling. Right. So I think it's more of a personal decision. I think if someone's like been a manager, been in the office, they don't want to deal with people, like remote is still very viable. That is totally okay.
Okay.
Yeah, great question. It's a very personal choice. Very
So it's
great.
like more about how you want to work, but you're not seeing
Yeah.
among your mentors or mentees that like people who apply to local jobs are getting more interviews than people who apply to remote jobs.
No, it's kind of all the same. Yeah. Community outreach manager. This one is Essentra Health. I think this is the community benefit arm of a healthcare company that I told you guys about. 6 years combined translation, transcreation processes, bilingual speakers. Hmm. Oh, I love this. Community organization, coordinated care organization, or Oregon Health System experience, lived experience advisory panel and council panel experience. I love this. This is calling out just the fact that this organization taps into patients and community and asks for their feedback. And so they're just simply calling out if you've been part of raising your voice or using your story. Now, keep in mind, lived experience is always cited in public, not always, but will and can, and sometimes does get raised as lived experience counts as as actual experience, especially for those tough, complex issues, including homelessness, mental health, substance use addiction, right? So some of those spaces, even cancer, sometimes I see those companies say lived experience preferred. So there is a way to disclose that in your summary as well as your cover letters if you have lived experience in relation to navigating like a difficult treatment process or and it doesn't have to be you. Okay, keep in mind lived experience doesn't mean like you're the one who lived it. It could be that you witnessed your sibling or your cousin or someone experience the issue at hand. So just pointing that out. This is a good one. This is only for, I think this is remote. Oh, Oregon. Oregon, Washington, or Idaho. But notice that this job, I'm searching community benefit, by the way, in my search community benefit US past week remote. Because I know from my intel and my insider knowledge that hospitals frame their nonprofit work as community benefit due to the way that the tax structure is. Whatever reason, for whatever reason, when the tax law was written, it said that for any non-profit hospital that wants to give back to community, that their funding is considered community benefit. And so that's why community benefit is something that's just used in the world of healthcare and hospitals for the community foundation arm. Okay. Keep in mind, while I worked at Kaiser, I was paid by the Kaiser Hospital Foundation. Okay. But some of you may have heard of, say, like the Kaiser Family Foundation. Oh, that's a separate entity too. Oh, we could talk about Foundations Kaiser all day long. There's the Kaiser Family Foundation. Okay, that's not who paid me. Who paid me was the Kaiser Hospital Foundation, not even Kaiser Permanente. Kaiser Hospital Foundation, because that's the arm that was giving the community benefit arm. Okay. Just again, trying to help you guys out with understanding the landscape as much as I can. Focus area, environmental health. Great, you go. When I search for environmental health, I get positions for cleaners. I know. So for that, I've been trying to search for things like air pollution, climate change. Okay, good. You can search particulate matter. You can search, oh my gosh, air quality. No, then you get a lot of like tech. Okay, I'll keep all this in mind. Mental health, maternal health, child health. In the current scenario, are there any specific focus areas which are being affected a lot? Yeah, I mean, equity, um, health equity is getting hit. Refugee immigration is getting hit. Maternal health is getting hit. Um, you know who I'm watching carefully, guys, is substance use and addiction and mental health services. Here's why. Because this is another example of where the money is. The Pfizer, I think it was a couple companies have opioid settlement agreements with states. And I know North Carolina is a gold star in the settlement agreements. And I say that in the sense of the settlement agreements are a private issue. It has nothing to do with the federal administration changes. So what happened was states took the pharmaceutical companies to court saying that they caused the opioid crisis and thus public dollars had to rescue and save and be provided to these communities that were targeted and basically just slaughtered with the opioid crisis. It's been so tragic just seeing how it's devastated certain communities. all of this to say that that settlement money is then being managed privately. And I know mentees, especially in the North Carolina space, that work in that area, and they know how to maneuver and be nimble because they understand the settlement agreements. And so if you know where the money is being pumped out from these settlement agreements for opioid addiction and substance use, that is also another pathway for for-profit jobs. Okay, not for-profit jobs, but remote work or spaces that are non-government, non-federal funds. Settlement agreements. Okay, please write that down if you're interested in mental health. In fact, I might search that just because I've been keeping my eye on like where the money is going to keep flowing or if the jobs are going to sort of shift. Now, notice there's still a lot of like work in community health, like community health workers, community health education, chess, promotoras, like that work is still happening, especially when it comes to health care and hospitals. This one's pretty cool, community relations manager for 90K. It might be marketing. Sometimes these jobs are a little more on the marketing side. There it is. So just keep that in mind that like sometimes you are going to see the jobs that are not solely community health, community outreach. There's going to be a little bit of expectation for you to like bring in new relationships. And if that's why, then that's why it's paying you more. And you can do it. Hey, go make that money. Go sell that health plan. I just want you to know what you're getting yourself into. Social impact manager, love to see it. Please tell me it's correctly used. 80 to 100,000. See, guys, there's a $100,000 job. Please tell me. Oh, expertise in FPIC and feedback and grievance redress processes, social impact certification frameworks, experience managing international teams and working across diverse cultural contexts. Oh, here it is. Fluency in French or Spanish preferred. Now, this is telling me that this is more grievances. Grievances tends to be used for healthcare when someone makes a complaint or a claim that the organization mistreated them. And so that's grievances. Lead community engagement strategies to ensure meaningful participation in restoration projects. Okay, this is telling me this is not, yeah, this is a no. This is a no. And this is what pisses me off, guys. The companies that are using social impact in a non-health related way, it like frustrates us because we can't find the actual jobs that apply to us. Okay, so this one says community outreach and screening education manager. I've seen this one from Sanofi before. I'm pretty sure it's still a nurse that they're looking for. Yeah, clinical practice. So, all right, let me search settlement. I'm not in a major rush. I can stay on like 10 minutes extra. I just really want to take a little bit of a breather before my day keeps like just going. As you guys can imagine, my phone's been blowing up. I also promised for anyone on LinkedIn or Instagram, I haven't even gotten to everyone. For those of you who saw my LinkedIn post, I said if you were laid off on April 1st or feeling the impact, you're welcome to send me your resume or DM me because some of you just need to connect. I'm still getting to those. Like it's been a lot. And so I'm trying to take breaks as much as I can. Community Impact Specialist, Centene Corporation. Oh, I think one of my mentees applied to this. I think. This one talks about marketing. Yes, yes, yes. Proven ability to mobilize people to join a social impact or engagement initiative. I hate when their requirements are like a whole paragraph. Now I'm pointing you towards Centene only because yes, like this is yet another nice remote job, 55 to 90,000, 99,000. Notice the title, Community Impact Specialist, but notice that it's employee service. And this one's unique because provide administrative support for community impact leadership in facilitating monthly impact connect meetings. So it sounds like this is like a workforce development kind of empowerment space that they hold for their employees or for other leaders in the community. And so they're looking for someone who, could really foster that as a specialist for them. So, I can't tell if this is in Mississippi or they're just posting all over because I could have sworn I've already saved this and my mentee applied to it. And so I don't know if there's just multiple options, but I'll put this in the chat for you guys. So I'm searching opioid settlement just as an example of where you might be able to find, right? One of you said that you're interested in mental health. So to me, substance use is still in that space. Um, Yes, there's case management that comes up. That's probably the hardest part with navigating the mental health space is that you run into LCSW work, LMFT work, where they want you to be a licensed family therapist or social worker, and that's not what you're doing. Um, so I think, or it's case management, right? And that's also not the work that you necessarily are looking for. Member and community directors for SHRM. Who are you people? Innovation, membership growth. Okay, so this one is business to business now. Church and community engagement coordinator in North Carolina. Anybody in North Carolina? Fundraising for a nonprofit. So there might be some fundraising conversations in this one. It's not necessarily what I want you guys to have to do, but I get it. All right, this one is not yielding. It's not giving. This is not giving what I wanted. Let's try Centene. See, Centene is posting all over the place, guys. This is the same one I just saved. It said Missouri, now it says Texas. So I think they are posting this one like remote, but they're also having a hard time getting noticed. So I think they're just posting all over the place. Ooh, what's this? Program Manager, Regional Child Care Coalition. This might be looking for a child care development professional, but sometimes they don't care. I think it just depends on the scope of your work. Specialist in training or technical assistance applicable to early childhood systems building. Yeah, this one's leaning more in child development. Oh, environmental justice. That's when you go search up more just social justice, environmental justice. There's a lot of that it's being described, or environmental impact.
Thank you.
That is a good one. Yeah. Community engagement organizer. This one might be And then I know you probably run into canvassing jobs where they want you to collect signatures. That's the other thing you want to weed out.
Oh, like for environmental justice specifically, or for
Yeah, you're gonna run into jobs where they want you to like be a canvasser and get signatures. That might be a great part-time job. Hey, I don't know. It's up to you, but I'm just letting you know to be mindful to read through the job if that's what it is or not.
Mhm.
1 year in environmental advocacy, policymaking, event planning, or community engagement. Please pay attention to the or. Or. Knowledge of. Great. Is the salary on here? What is this? That's different. Oh, that's not a, oh, that's something else. Okay. Oh, cool. This role seeks a candidate with passion for environmental justice, policymaking. It's for King County and Seattle, building grassroots momentum for environment. Cool. Okay. All right, you go consider your request done. Found something different. Angie, there's our intern. Hi, Angie. I've been seeing that same job posting. Yes, Angie. They're posting it all over. When I search by environment, I get positions for cleaners. Oh yeah, I already read that. Okay, let me go back and see if I can find maternal and child health maybe and more mental health. Oops. Oops. Clicking on too much stuff. Okay. Mental health, substance use, behavioral health. You know what? Hold on. I'm going to look up alliances first. So the other thing I wanted to educate you guys on is like where to find, I'll stay on for 10 more minutes. So where to find more remote options. This is what we're going to focus on for the last 10 minutes because some of you, like you said, you're not sure if you have a chance or not. Yes, they're still out there. You do have a chance. It has to do with how you're tailoring, how you're being aware of what their requests and their requirements are. Now, when I have mentees come to me saying, hey, I need a remote job, there's a lot of reasons people still need remote jobs, guys. Like I need a remote job, right? Like, this is why, being a coach works, but even at Kaiser, I was working remotely. There's no way that I could do on site. I have a young family. And then also I talked to some of you who are dealing with your own health problems or your own health challenges, and you just know you can't be like mingling with people. You need to take care of yourself at home. So at the end of the day, there are remote options, but the way that I find them has to do more with pointing my mentees towards like alliances, societies, unions, coalitions, consortiums, or any sense of how um, a cause would come together for many, not just for one company. And so the way they describe the work is through this space of alliances and consortiums and collaboratives. And the reason that they're likely to be remote is because they need people who specialize in what they do, whether it's community engagement, operations, stakeholder engagement, partnership development, grant making, whatever that is. They're happy to have the right candidate regardless of where they sit across the nation because their work is virtual. Or like they plan conferences, for example, where it's like once a year we put together this massive conference and you're part of the team for that, right? So I think it just depends. So I'm looking up alliances. Maybe if I take off that. Isn't that funny? Did you see that? I'll do it one more time. I did alliances with an S, and you get Spring Health, American Heart Association, and Alma. And then if I take off the S, you get different companies. Alliance, We Make Change, Nourish, Pitch Labs. And then that fourth one is a public health intern. I love it. curriculum development. Oh my God, I love it. I'm gonna put this in the chat in case anyone's looking for an internship. It was posted 19 hours ago. Love it. Angie, I might just like uh keep adding some of these. I'll text you later. Just because it's Public Health Week, and if you and I have the bandwidth to add a few more from this list, that might be worth it. No pressure. If you're busy, it's fine. Intern for Colorectal Cancer Alliance. All right, another internship, $20 an hour. Cool. Paid internships. Yes, yes. Now notice that they are a national nonprofit organization, but their name is Colorectal Cancer Alliance. They have 5 paid internships. Love it. Cancer care, corporate partnerships, marketing, research, and volunteering.
Zoila, can I ask a question?
Love it, love it, love it.
Zoila, can I ask a question?
Answer.
So
Hi,
one,
Odellis. Oh,
sorry,
who's that?
I
Sorry, who's that
interrupted
talking?
you. That's Cynthia.
Hi, Cynthia. Sorry. Hi.
No, no, it's okay. So when it says intern, and I know that I think you said if it's unpaid, it should go in your kind of leadership section. Um, this kind of example could fall into the work experience side, right? Because it's
Yes. Yes.
what if it's
And
unpaid, but it's still like relevant work?
yes. So the leadership section that I tell you guys to add to your hired resume, right? The sections are summary, education, experience, and then fourth category optional is leadership. You're welcome to use that and take it off as needed. In fact, I don't really consider the leadership section as paid or unpaid. I think it has more to do with what you want the first page to really shine. And so you can pull things down. So that way, because some of you are worried about the chronological order of your resume, and I'm here to remind you that that doesn't matter as long as you're disclosing it, right? So if you want to change things because, oh, you know what, this unpaid internship experience is more related, right, to the job that I'm applying to,
Okay.
you can put it up at the top. That's totally fine. Yeah, Cynthia, that's a great question.
Right, because like a lot of people who are in MPH programs, you have this practicum. And
Yes,
it's paid, but it's such relevant experience.
yes, yes.
Thank you.
Yeah, of course. So I'm just trying to look for some different options for you guys. Look up Alliance, look up Society. Right, Children's Hope Alliance, we just saw that. Let me look up Society. I like searching that one too. These tend to be organizations that support the workforce. So I'm trying to point you to associations, alliances, societies, coalitions, anything that supports the training of the workforce. So a good example is like the California Primary Care Association. Um, there's also like the national ones like the American Medical Association, American Hospital Association, the Association of State and Territorial Health Officials, the National Association of City and County Health Officials. And mind you, a lot of these are funded. Yes, there's sometimes federal funds, but some of them actually maintain different funding streams, such as a membership subscription-based fee for individuals or companies. So sometimes the company is paying in on the coalition. And so like I know Kaiser does that a lot where like they'll pay in to be a part of something so that any staff member can come and sit as needed throughout the years to certain conversations. So it just depends on how they're organized. Okay, this one's like not giving me much different. Oh, okay. So for some of you who were, this will be my last note for office hours, and then we'll log off in a couple minutes. So some of you may run into jobs. Um, yeah, this is with the Comprehensive Care Center. So I'm looking at University of Miami. Universities are still viable. That's another place you guys can look. Did not talk about universities at all this whole hour. Bless their hearts. They are out there supporting the workforce. But what I wanted to point you guys to is that the universities tend to be structured in a couple different ways. They have internal jobs for serving their staff or their student body, right? So maybe you could be a health educator for this for the student body, and so then you're hired by the University of Miami. But then they also have jobs where it's to serve the community, to be out there for community and work with community. And sometimes those are posted in a different career center altogether. Also, for example, like at UCLA, when I'm a Bruin, and I think after graduation, I tried to work with them, but it took me a while to realize that they had UCLA Health Career Center. So at UCLA Health, you can poke around their works with clinics, right? Maybe you can find jobs working at the clinics, like as a, health educator at a clinic, right? But then they had UCLA proper career center where it's like for the campus. So you could be a health educator for the campus. So I'm giving you guys as a warning, if you want to look at schools, don't just assume they have one career site. Make sure that you're aware if they have another career site, because that happens. And the reason I'm putting this one up here is because the way that they talk about their work is kind of funny. So this is about grants. Some of you who just got laid off or have been in the space of grant making or contracts management with federal funds, state funds, local county funds, anything like that, you can compete for jobs that are for grants management or contracts management at the universities. But the way they talk about it is completely different. Their jobs, like the one you see here on the screen, says manager of sponsored programs post-award. They're talking about post-award, meaning you're now managing the grant after it's been awarded. You're not even part of the pre-award. So I've seen jobs for private companies as well as universities where they're split between pre-award and post-award or research-based, right, versus non-research based. So this is a great example of where you guys just need to get more resourceful on discovering your options, and don't, assume that your understanding is going to be the way that they talk about their work. Okay. So I'll leave it with that note. Okay, thank you everyone for coming to today's office hours where I got to search with you for jobs that are remote, for profit, more focused on, some sort of financial security, getting you out of this federal space, grant making space, funding space that's, being really greatly impacted by the Trump administration. So I hope this was helpful. I hope you guys feel like you have a little bit to work with moving forward. Obviously, I'm here. DM me, email me. I'm going to try to be active this week on social media. But I'm still juggling, as you guys can imagine, just the storm in the background with, people needing help. So, please be patient with me as well. But I'm here for you. Please check in. Please take some space if needed too. You're welcome. Have a wonderful day and have a wonderful week, okay? Thank you everybody for coming. Bye. Happy National Public Health Week.